As many of you are likely familiar, South Carolina has been working towards updating our 2011 requirements. It's pretty old for evaluation and eligibility as a student with a disability under the Individuals with Disabilities Education Act for several years. Many of you have actually already been part of the various stakeholder groups specific for speech language impairment. And many of you have already been participating in the LEAD SLP meetings over the past 3 years, where some very specific aspects of the proposed criteria have been discussed in depth. So much of what you're going to see today is not going to be surprising. Now, on May 20th, the 2020-24 SEED, Standards for Evaluation and Eligibility document, that was posted on the OSIS website. The goal of today's presentation is really just to share with you the differences for speech language impairment, that one area only, the difference between 2011 and 2024. Now, as I mentioned, this session is being recorded, and in doing so, the hope is that you will share this not only with your SLP personnel, so they're comfortable with the differences, but also to share it with your administrators and anyone in your building that serves as an LEA in an IEP meeting in order to prevent confusion about initial eligibility as well as ongoing eligibility for speech language impairment in the future. Now, because this session is being recorded and because we only have a specific allotment of time, I'm not taking questions, and I've disabled the chat and their microphones. So again, so that we can get through all of this content. Now, you may have specific questions later about assessment procedures and assessment tools, but I'm here to tell you another bit of good news. There will be a whole series of subsequent videos. And the entire series of videos is coming over the summer, and it will be posted to the OSIS website. It will go into more depth on things like, what do you need to consider before evaluations, speech sound disorders, language or developmental language disorder, special education and the new ELA standards, feeding and swallowing, which we're referring to as unique mealtime needs, culturally and linguistically diverse evaluations, developmental delay and the SLP role, autism spectrum and the SLP role in that assessment, as well as fluency in voice. So, but the purpose today is just a comparison between 2011 and 2024, specifically just for speech language impairment. I will be emailing you a copy of this PowerPoint after our presentation today. But again, if you have questions just about the comparison, then email me. But otherwise, look for all of these additional trainings to come to you, and you will be getting all of this information step by step. So the biggest difference that you're going to see between the 2011 and 2024 criteria is that the new criteria is very clear in terms of evaluation procedures and what does and does not warrant consideration of eligibility by the IEP team. Great lengths were actually gone into in order to ensure that evaluation and eligibility would be clear not just for the SLP, but also the other IEP team members who are not SLPs. In being clear about these requirements can then be implemented consistently throughout the state. Also, significant emphasis has been on ensuring that the speech language concerns meet the prongs of eligibility as a student with a disability according to the laws of IDEA, because there is a difference between eligibility under IDEA and eligibility for speech services anywhere else. The biggest difference being that in a school, just having the presence of a disability does not mean the student has a speech language impairment according to IDEA. IDEA requires that the disability must also have an adverse educational impact, such that it requires specially designed instruction in order to meet the educational standards that apply to all students. So the 2011 information, you will be able to point that out, not just because it's got 2011 beside it, but also it's going to be green. Now, I'm not going to go into great detail, just hit some of the highlights from the old information. but I'm going to spend more time on what you're going to see now, which is the 2024 information, which will be blue. So in terms of the definition of speech language impairment, you'll see not much has changed. Students can still qualify in one or more areas in what is considered a communication disorder. That includes speech sound production, language, fluency, and or voice. So one difference though is the term speech sound disorder. This may be new for you. Now, speech sound disorders with no known cause were historically called articulation and phonological disorders. However, speech sound disorder now replaces that term articulation as there's new information that has been learned in the field of speech language pathology since 2011. So speech sound disorders, I want you to know and appreciate that is the correct term. And it is a term that is really an umbrella term that refers to any difficulty or combination of difficulties related to speech perception, speech motor production, and even phonological representation of speech sounds and speech segments. And that is exactly what that graphic there is demonstrating. The definition of a speech sound disorder reflects exactly this, noting atypical production of speech sounds that may result from phonology, motor, and or other issues or disorders. You'll also see in the 2024 definition of speech sound disorder, intelligibility as well as adverse educational impact is consistent across both 2011 and 2024. Now, each area of speech language impairment, this is new, but each area of speech language impairment will include exclusions, meaning these things are not considered as being eligible for speech language impairment under the IDEA. So for the exclusions for speech sound disorder, these include inconsistent errors or situational errors, regional, dialectical, or cultural differences. We're going to go in more depth on that in just a moment. Speech sound errors that are at or above the age level, meaning these students should have developed these sounds based on the developmental continuum, but they haven't. Now, what ages are most students expected to produce certain sounds? Well, for that, we have to use the most current research-based developmental norms to determine this. And this is something that we will discuss in greater detail, much greater detail, in the video that is forthcoming on speech sound disorder, evaluation and eligibility. Speech sound disorders also exclude speech production difficulties that do not have documented evidence of adverse effect on educational or functional performance. Because without adverse educational impact, the student does not meet the criteria according to IDEA as a student with a disability. So the criteria for speech sound disorder includes the student must meet both number 1 and number 2. So for number 1, they must have at least 2 out of the 3 things listed here. That includes 3 or more consonant speech sound errors that they should have developed by their age, and or developmental or non-developmental phonological process errors that are occurring at least 40% of the time. That's the first one. The second is stimulability, less than 59%. And then because it's 2 out of 3, and or percent of consonants correct, less than 84%. That's number 1. Number 2, and remember they have to meet both, is that the speech sound impairment must have an adverse educational impact. Now let's go into greater detail on that piece. So this information is not part of the SEED, but being presented here as examples to help illustrate what is meant by adverse educational impact. There must be data that is specific to this student. data on this student specifically that documents the adverse educational impact for this child. Adverse educational statements may not be generalizations. This would include statements such as the speech sound disorder may impact their reading or spelling. Adverse educational impacts must be individualized to the student and based on data. For example, in a review of written work samples, the student's documented difficulty with producing K's and G's is reflected in their spelling of words with those same phonemes. Another example might be, according to Phonological Awareness Probe data, as well as universal screening results, the student's speech sound disorder includes difficulty with phonological representation of speech sounds, which we included in that definition earlier. And that has a direct impact on acquiring those foundational literacy skills according to grade level standards. Another example, according to data collected by both unfamiliar and familiar listeners, looking at the student's intelligibility, the student's documented speech sound disorder has a direct impact on their ability to be understood when communicating across curricular subject areas. And finally, upon observation, so now we're looking at not just what we see in our evaluations, but also what we see in the classroom. So upon observation in the classroom setting, the student appeared to avoid speaking in front of the class and or stated that it might be because they didn't want to be made fun of. The big takeaway being, though, without the data, specific documented data for how this student's disability, which should be different from other students, how does it impact this student specifically, then our findings are not individualized to that student. And as such, we're not clearly outlining how the student does or does not meet the requirements for eligibility. Now let's continue on with the criteria. Each of the areas of speech language impairment, including this one, speech sound disorders, will also have some special considerations. So for speech sound disorder, we need to give special consideration to things such as any deviations of the oral mechanism or structure. In other words, are there dental malocclusions? Are there any deviations of the teeth? Or any deviations of the hard palate or the soft palate, such as a cleft or a fistula or even a bifid uvula? And there must be documentation that if these structural issues are present, if they do or do not impact the student's ability to correctly create those sounds. Because if there is such a deviation that would not allow them to create or produce those sounds, then therapy alone may not be able to correct those errors. In other words, there's not a prognostic indicator that therapy would have an impact. So these concerns, such as the ones I just listed, those are not amenable to speech therapy alone. They may require orthodontic or surgical correction. So again, if you see those kinds of concerns, and those are documented in the evaluation, we need to appreciate that no amount of speech therapy alone can make up for the fact that if they're trying to produce an L sound, which requires the tongue tip to go up, if the tongue is so closely tied to the floor of the mouth, it's highly unlikely that any amount of speech therapy is going to be able to get them to get their tongue tip up and where it needs to be to touch the back of the top teeth. So we need to make sure that we're considering those types of structural factors. Here are the 2011 evaluation requirements for a speech sound disorder. And here are the 2024 differences or evaluation requirements. Now, the differences you will likely see include, number one, standard scores are not required for eligibility. I'll say that again. Standard scores are not required for eligibility. The reason being, IDEA does not require standard scores for eligibility for any area of disability. And there are many reasons for this, which will be explained more in the subsequent training series. But what I want you to see or appreciate is that we're looking at other specific aspects. So what you're going to see is there's a reference to assessment of the specific skills that also support adverse educational impact, all of the things I just discussed. So that includes intelligibility and looking at phonological awareness. Another big difference that you'll see here, as you'll see down below, is that there are specific requirements for supplemental measures, such as dynamic assessment, you see that in blue, when you're assessing a student who is multilingual or speaks with a dialect. And there's very good reason for that. The reason for that is because languages and dialects differ from General American English, which is what we're looking for. They differ based on their phonology, their sounds, the sounds of language, and how those sounds can be combined. It also, languages and dialects also differ in terms of semantics, syntax, and morphology. So I've given you an example here of why this is important. English has 24 consonants. Spanish only has 18 consonants. So automatically, we already know that there are 6 consonant sounds that we should not consider as being an error because the student's primary language does not include those 6 consonants. However, we do want to make sure that motorically that student can produce it. And the way we determine that is through supplemental measures such as dynamic assessment. So another example, French, German, Japanese, Korean, Mandarin, Russian, Spanish, Vietnamese, and many dialects of English, General American English. They do not include the voiced TH and the voiceless TH. So again, we don't want to test them on something they shouldn't know based on what their primary language or dialect. But we do want to make sure that motorically they could. So again, the way we do that is through dynamic assessment. That if we teach them that skill and they subsequently demonstrate the ability to produce that sound, then we can note that. We also do not want to consider a student's production of a sound that is present in both languages, but maybe they're produced differently in the mouth. We don't want to find those as an error. So for example, the Spanish S is produced more frontally than the English S. The Vietnamese T is more interdentalized than the General American English T. So in other words, the role of the SLP is to evaluate and remediate sounds that are in error. They are unable to produce. Now, what I've given you examples of here on this slide are not errors. They are differences to be respected. Now, as mentioned at the beginning of this training, we went into great lengths in order to ensure that the entire IEP team has clarity about the findings of the evaluation results in order to determine eligibility, because eligibility is a team decision. However, without knowledge of both state and federal laws, as well as the knowledge and training and expertise of an SLP, if everyone on the team does not have that same background, this can result in a lot of confusion in terms of determining eligibility. So what's been provided are rubrics. So these rubrics are a visual method for all IEP team members to process this evaluation information as they're being gone over and as it relates to eligibility. Now, these rubrics are optional and they are not included in the SEED, but they are very helpful in order for the entire IEP team to make an informed decision about eligibility. Not only initial eligibility, but also ongoing eligibility. Here's what the rubric looks like for speech sound. So again, going back to the criteria, 2 out of the 3 must be met. So that would include presence of 3 or more phonemes that are developmentally expected but not present, looking at stimulability, as well as their percent of consonants correct. And then the adverse educational impact is also included there. And that could be specific to their how well they're doing towards the curricular standards, especially those for the foundations of literacy, as well as written and oral communication, as well as intelligibility and or phonological awareness, which that one is part of the foundations of literacy. So your key takeaways when looking at a speech sound disorder, your key takeaways should be this. Number one, standardized assessments are not required, nor are standard scores. Second, we need to give consideration to the dentition and other structural impacts of the oral mechanism when they are not amenable to treatment alone. Also, again, mention of the rubrics, because that's very helpful for looking at initial as well as ongoing eligibility, making it very visually clear for your IEP team members. Big emphasis on adverse educational impacts on educational performance for that student, and consideration for regional, dialectical, and cultural differences. Now we're going to move into language. Now, just as speech sound disorder was the new articulation, DLD, or what's referred to as developmental language disorder, that is the new expressive receptive language disorder. Now, what is DLD? Well, DLD is really, it's a language impairment that is not due to intellectual disability, genetic syndromes, or other medical events such as a traumatic brain injury. In other words, this is a true, pure language impairment that's been present since birth, and it reflects difficulty learning language from their environment. Now, can or should we use the term DLD instead of expressive receptive language disorder? Yes. And there's nothing in IDEA that would prevent using this correct terminology. Matter of fact, that third bullet, that is a direct link to a memo from OSIP that confirmed this in May of 2023. That again, there's nothing in IDEA that would prevent using the correct terminology of DLD. This is very similar to the OSIP memorandum in not only saying that it would be appropriate to use the term dyslexia, but encouraging schools to use the term dyslexia when appropriate. Now, why is that? Why do we want to make sure that we're sharing the correct terminology? Well, because often when a child is diagnosed with a disability, if you were diagnosed with a medical condition, what would be the first thing you do? Go to Google. And so when you go to Google and you look up expressive receptive language disorder, there's not a lot of clear information. So in the very first bullet, what you see there is a link to a page called DLD and Me. And it is specific to information for parents and providers about DLD, about developmental language disorder. Now, let's look at the definition of DLD. So here's the definition for DLD according to 2011 and 2024. Now, what you will see is the definition for 2024 more clearly defines the areas of language: phonology, morphology, syntax, semantics, and actually pragmatics is not included here for a reason that you'll see outlined in the exclusions in just a moment. But a deficit, spoiler alert, a deficit in pragmatics alone does not constitute a language disorder, a DLD. DLD does not include isolated, singular areas of language weakness. DLD reflects, as stated earlier, a deficit in learning language as a whole from their environment, not just one area of language. So here's some of the other exclusions. DLD does not include anxiety disorders, such as selective mutism. It also, again, does not reflect regional, dialectical, or cultural variations, and no dialectical variety of English is considered a disorder. I'm going to go into that in more depth in just a moment. Also, children who are learning English as a second language, who do not exhibit difficulties in both languages. I'll say it again, in both languages, because this bullet makes it very clear that in order to determine that there is a deficit in language, the language deficits must be assessed in both languages and present in both languages. Also, another exclusion is children who have auditory processing deficits that do not also have language impairment. And then finally, again, as I mentioned, children who only have an isolated pragmatic language or even phonemic awareness deficit. Now let's look at the criteria. Now, the criteria, we didn't have this very specific criteria for 2011, so it's not a slide that I can post. But the criteria for DLD 2024 includes meeting at least 3 out of the 5 things listed in number 1, as well as what's listed in number 2. So let's look at number 1. First is a composite score, meaning the overall score, not a subtest score, but a composite score that is 2 standard deviations or more below the mean. Now, as you'll see in a moment, the criteria for was sort of embedded in the evaluation in 2011 criteria, and that was 1.5 standard deviations below the mean. However, if, and it's a big if the SLP is using a standardized assessment, which is not required under IDEA, then 2 standard deviations below the mean can only be considered if that cut score for that tool or that assessment is at 2 standard deviations, meaning at 2 standard deviations, that test says, yes, there's a presence of a disability, because those are different from one test to the next. So we have to consider what is the cut score for that test, because cut scores are different for every test. In addition, each cut score, we have to look at what is the sensitivity and specificity for that cut score. And the minimum we're looking at in terms of sensitivity and specificity is 80%. If it's not 80%, then that test or that finding is not diagnostically accurate. So as such, if you have given a standardized assessment and it doesn't meet this criteria, more data has to be gathered in order to support the presence of an impairment in language. Again, it's not that you can't use these tools, but we have to consider the diagnostic accuracy. Now, this is probably the biggest change from 2011 to 2024. But again, over the past 3 years, this has been information that has been shared with lead SLPs, and it is something that will continue to be shared in the subsequent videos that are being recorded. Now, the bottom line is, again, an IDEA does not require a standard score. Also, a standard score alone cannot determine the presence of a disability. That is an IDEA specific regulation. Additionally, not all children are appropriate for standardized assessments. And now our field actually has a variety of better, more valid and reliable tools. Now moving on, still looking at meeting 3 out of the 5 under number 1, we also need to determine the presence of a language impairment. It could also be documentation of 2 or more phonological awareness skills that do not meet age or grade appropriate norms. Again, looking at the continuum of development. Narrative abilities that are 1 year or more below what's expected for their chronological age. Language samples that document 3 or more skills in morphology, syntax, and relational semantics and or pragmatics that do not meet age-appropriate norms. And then 2, dynamic assessment. Dynamic assessment results that reveal and they look closely at the student's modifiability. That modifiability supports diagnostic accuracy related to any of those areas, morphology, phonology, syntax, pragmatics, all of the above, and helps support the need for specially designed instruction. Then we get to number 2. Number 2 is, again, who's going to say it? Adverse educational impact. So let's outline this one in a little bit more detail. Now, again, this is not in the seed. This is provided for more clarity. So again, there must be data specific to this student that documents the adverse educational impact of this student's disability, and the statements cannot be this disability may impact their reading and spelling, anything general. They need to be individualized to the student and supported by data. So here's your examples. In a review of curricular-based assessments, the students' documented difficulties from our assessment with morphology, syntax, and semantics negatively impacts their reading comprehension. So in other words, the assessment discovered, yes, there's difficulties in morphology, syntax, and semantics. And now we see that because of those difficulties, their performance on social studies tests, science tests, and other curricular assessments, we see that reflected in their curricular-based assessments. In another example, in a review of written work, the students documented difficulty with pragmatics, semantics, and narrative skills negatively impact their performance when completing writing assignments according to grade level standards. So again, we've given the assessment documents those difficulties in pragmatics, syntax, semantics, and narratives. And now when we look at the student's writing notebook or a grade level appropriate writing assignment, we see those same difficulties match. And then finally, and this one is specific to preschool, upon observation, the students documented difficulties with play, narratives, and semantics negatively impact their ability to participate in age-appropriate activities with peers. So again, think about this from a standpoint of preschool. The SLP evaluation documented these difficulties with play along the developmental continuum, also documented difficulty with narratives and semantics. Now we're looking at the observation in the classroom, and that observation data supports the same thing. They match. We're seeing that the student has difficulty clearly expressing themselves using specific vocabulary, that their interaction with peers, they struggle with exchanging stories and information, and their ability to play and interact, have that communication with their peers during play is also impacted. And then finally, according to letter name and letter sound fluency data, and this is where the teacher's data especially is very helpful. So according to letter name, letter sound fluency data from the teacher, as well as universal screening results, which remember, those are required for 3 times a year for kindergarten and first grade. The students' documented difficulties with phonological awareness, morphology, and syntax are adversely impacting their ability to acquire early literacy skills. So this one speaks very clearly to the foundation of language that is necessary in order to be able to learn to read. So the assessment data again said, yep, they're struggling with phonological awareness. And honestly, phonological awareness has a close overlap with morphology. And then we also saw that there were difficulties with sentence structure. So what we're seeing is that classroom teachers' data on letter name and letter sound fluency, that's actually indicative of difficulties with phonological awareness. And then your universal screening tools also include a phonological awareness measurement. Now, the morphology and syntax, we may be observing more so when the student is speaking in the classroom or even in their writing, like their writing journals. But the whole point being, doing this deep dive on adverse educational impacts for language is, again, what is found in the assessment as a weakness. Does it match the difficulties that show up in the classroom setting? Because without the data for how this student's disability, which again should be likely different than other students' disabilities, how does it impact them? And the findings must be individualized to the student and must clearly outline how the student does meet these prongs of eligibility according to IDEA. Now, let's look at the evaluation components. As mentioned in the 2011 SEED, evaluation required findings of a 1.5 standard deviation below the mean. It's important to point out that this is not consistent. It's not consistent with evidence-based practices in assessment in the field of speech language pathology, because a cut score, any cut score, whether it's 1 standard deviation, 1.5, or 2 standard deviations, it's going to be different for every single test, because every single test has different methods and procedures for gathering the data to arrive at that. So again, there's not one cut score, such as 1.5 standard deviations, that's applicable for every test. Now, The evaluation requirements for 2024 are very clear, but that's why there's 3 slides on this. So first of all, of course, we need information for parents and teachers to describe what are these language concerns? What do they look like? We also need those observations that I spoke about. Then, if it's appropriate for this student, a standardized norm reference comprehensive assessment of language. And again, that tool has got to have a minimum of 80% sensitivity and specificity. The student has to match the normative sample. In other words, if the assessment was not normed on students from Russia, then that student was not, the test is not normed or appropriate for students who are from Russia. So we can't use that to determine eligibility because it doesn't align with the assessment. The assessment must also be administered and interpreted by a speech language pathologist. Now, this one is important to include because while school psychologists also administer assessments that look at oral expression and listening comprehension, this is not the same thing as a language assessment administered by an SLP looking at phonology, morphology, semantics, syntax, and pragmatics and narratives for the purpose of diagnosing an impairment in language. So again, we have to make sure we're looking at language based on language assessments designed for that and administered by SLPs. Here also, you're going to see mention of the confidence interval. The confidence interval, in short, really, if you're looking at 90% confidence interval, what that means is that the SLP is administering, who is administering this assessment, they can say with confidence of about 90% confidence that no matter when that test is administered and no matter who administers this test, that student's true score falls somewhere within a specific range of scores referred to as a standard error of measurement. Now, those range of scores in that standard error of measurement should be very, very, very small, within 2 to 3 points. In order to have confidence to say that on any given day, if this test was given by any other SLP, that student's scores would still fall within that range. And that is what gives us confidence in the findings. Also, we also have to look at non-standardized, scientific, research-based instruments. We are allowed to use those. And we also need to look at a variety of assessment tools and strategies. So formal and informal assessments are also allowed. And then finally, assessment of a student who is multilingual. Again, they have to, this is IDEA requirement. We first have to look at administering this test in the student's native language and not taking an English test and translating it into that language, which I'll explain why in just a moment. But first, we have to consider administering a test in that child's native language or other mode of communication in the form most likely to reveal accurate information unless it is clearly not feasible to do so. Now, again, this is language coming straight from IDEA. Also, as sort of mentioned earlier, standardized assessments that are not normed on multilingual populations are only to be used as informal probes and not reporting the scores, not using the scores. And standardized language assessments must be, we have to make sure we're providing more than just our standard score, especially for those students who are multilingual or dialect or speak with a dialect. And again, if we're looking at dialect, we have to look at a variety of things, including the contrastive and non-contrastive features of language. So to go more in depth on that, here's why this is important. Well, here we go. Languages and dialects differ from General American English in their phonology, semantics, syntax, and morphology, as I just mentioned. So for example, in Arabic, French, Spanish, and Vietnamese, the possessor follows the object and possessive morphemes are not even used. So for example, in saying the man's car, it's the car of the man. In Japanese, Korean, Mandarin, Russian, and African American English, plural morphemes are not present. They're marked by the number within the sentence, so they don't need to add the plural s. So for example, instead of saying I see two cats, it's I see two cat. In Japanese, Korean, Mandarin, Spanish, and Russian, articles, a, and, or the, aren't used. And Russian does not have the verb form of be. In Korean, pronouns and prepositions are not used, and Spanish only has one preposition. So again, this information is critical to know so that we're not counting these linguistic differences as being errors. They're not errors, they're differences because this is not part of their native language or dialect. And we have a rubric. So we have the rubric, which again makes it very visually clear for non-SLP IEP team members to visually have a good idea of what's being explained from the evaluation and then what the criteria for eligibility is. So your key takeaways are, again, standardized assessments are not required, nor are standard scores. If they are used, they have to have appropriate psychometric properties in order to say we have diagnostic accuracy, that this child truly does or does not meet the presence of a disability. If it does not have appropriate psychometric properties, you can use that test. You can still administer that test, but you cannot use those scores in order to determine eligibility. Again, we've provided the rubrics. We've gone over some of the examples, the specific examples, talking about adverse educational impact. And again, we're talking about multilingual students. The disorder must be present in both languages, which means evaluation must reflect assessment in both languages if the student speaks both English and another language. Of course, if the student only speaks one language, that does not apply. Now let's talk about fluency. So fluency, what you'll see is the definition is not terribly different from 2011 to 2024. But again, we do make sure to point out the difference that the adverse educational impact must be present. Now here's the definition. The definition of fluency actually also outlines the difference between stuttering and cluttering, noting that yes, stuttering and cluttering can co-occur, but while children who stutter are more likely to be aware of their stuttering, aware of their disfluencies, and they may exhibit more physical tension, secondary behaviors, negative reactions, and things like that. Children who clutter may exhibit more errors related to rapid rate of speech. They may appear not to know what to say or how to say it, or they may communicate in a disorganized kind of a way. The criteria for fluency, 2 of these must be met. So frequency of the disfluency, what is to be considered there? The description of the fluency, what do we need to consider there? Also looking at non-vocal behaviors as well as avoidance. So again, 2 out of those 4 must be met. And there has to be adverse educational impact. Now in the definition, it states this: significantly reduces the child's ability to participate within the learning environment. What you see here provides more clarity about this. So again, comparison of data that supports evidence of educational struggle in most or all areas when compared to peers. This relates specifically to struggles communicating verbally in the educational environment compared to peers. We also have 2 observations that reveal difficulty communicating verbally in the educational environment is dissimilar to peers. And then we also have a score on a tool called the Overall Assessment of Speakers' Experience of Stuttering. This is a tool that looks at how that person feels about their stuttering and how that impacts them. So this is a tool that's free, it's online, it's also posted on our SLP Wakelet. In terms of criteria, we did not have this in 2011, but in 2024, we're also giving that consideration for the, yes, there are periods of normal disfluency. Typically, this occurs in very young children. However, if these characteristics of disfluency continue for more than 6 months, or they're not decreasing, then we do want to consider looking more closely at this. Here's the 2011 evaluation requirements. What I have highlighted here is that observations must be done by 2 different observers. In 2024, that's different. So the biggest difference between 2011 and 2024 for fluency is that while different observations are required, 2 different observers are not required. Also new in 2024 is that if the student is multilingual, disfluencies have to be observed consistently in both languages. So here's what we need to consider when we're looking at that. Why do we need to look at this for multilingual learners? Well, when we look at the stages of language acquisition, number one, we don't want to mistake what's referred to as the silent period as being hesitant to speak aloud in class. We also don't want to mistake telegraphic or intermediate fluency with a second language as being mistaken for disfluency. Because without a doubt, if I were traveling back to Belize, to Ambergris Caye, one of the most beautiful places on the planet, if I were attempting to speak Spanish, I would have lots of pauses. I would say a lot as an interjection, and I would sound very telegraphic in my speech, but that is not stuttering. That is an attempt to suppress one language while applying another. And again, here you see the fluency rubric. Again, it's optional, but it's again, a helpful tool to make things visual for non-SLP IEP team members. So your key takeaways for fluency: 2 observations across multiple contexts. Observations do not have to be completed by 2 different people. If the student is multilingual, we have to consider the stages of language acquisition. And also that disfluency must be observed in both languages. We shared the optional rubric. And also, there must be specific data individualized to that student that document the adverse educational impact. Now let's talk about voice. We're almost at the end. So the definition is pretty much the same. Now, I've highlighted the 2 big things from the 2011 criteria to 2024. So 2011, again, we need clearance from the medical doctor with a medical description of what the SLP would never be able to observe about the vocal mechanism without specialty equipment, which we don't have. But that said, medical clearance alone is not a criterion for a disability. In schools, according to IDEA, we must also document that adverse educational impact specific to that student. So the 2024 criteria outlines this very specifically, and it says that we have to make sure we have this clearance before eligibility determination. I'll say that again. Medical clearance is required prior to determination. And why is that? It's because we do not want to start the evaluation process and go out of compliance waiting for the doctor's visit to be complete. Because what if, for example, the vocal impairment is structural and it requires surgical intervention? Could an IEP team write an IEP for a structural issue that cannot be remedied with therapy alone? No, because there's no prognosis for improvement without the additional intervention. So also there's a free online and posted to the SLP Wakelet Pediatric Voice Index. This tool is an evidence-based tool that specifically and objectively captures the impact of the voice impairment. And this criteria echoes that as well. Now here's the exclusions. The exclusions for voice. In other words, this would not be considered a speech language impairment in the area of voice if vocal differences are present. And what I mean by that is vocal differences which may sound unusual, but some languages actually speak in certain tones or other ways of communicating meaning, such as through clicks, which may even be a nasal click. So we don't want to count off for that. Also, vocal concerns related to medical issues that are not related to the vocal mechanism. So for example, seasonal allergies that result in temporary coughing that leads to hoarseness, or football season for a particular team, not to name any, that is not having a particularly good season, and there's lots of yelling at the football team, which results in hoarseness, or even reflux that causes irritation of the vocal mechanism, which can otherwise be treated pharmacologically. Also, voice does not include selective mutism. Now, sometimes this presents as talking in a very quiet voice, and that is why the evaluation, as you'll see on the next slide, requires looking at both areas of low vocal demand and high vocal demand. Also puberty, and again, voice concerns that do not have documented adverse educational impact. So again, the evaluation procedures, this is where concerns and descriptions for parents is very, very important. Also, as mentioned, the 2 documented and dated observations of high vocal demand and one of low vocal demand, as well as criterion reference assessments, information from the physician, and comparison to peers to support that adverse educational impact. And again, here's the rubric, totally optional, but very helpful. And your key takeaways. For voice, medical clearance must happen before eligibility determination. Physician orders are not the sole criterion. Rubrics are very helpful. And then 2, adverse educational impact. What data specific to this student outlines educational impacts specific to that specific student's voice concerns. And then our next to the last slide is going over what's referred to as assessment and eligibility related to unique mealtime needs. Now, this is not in the SEED. It's not in the SEED document, but it is important to briefly touch on assessment and eligibility related to feeding and swallowing, or again, what's being referred to as unique mealtime needs. So this is not a standalone area of speech language impairment. Actually, more often than not, a student with unique mealtime needs related to feeding and swallowing, this is more likely a student who's medically complex, and they might already be classified as having an other health impairment or some other underlying medical diagnoses, such as cerebral palsy or genetic syndrome. Now, 2 critical points. 1, if a parent or teacher expresses a concern about the student's ability to consume food or liquids at school as part of their meals and snacks, the team cannot say, nope, we don't do feeding and swallowing in schools. You cannot say that. The team must meet to discuss those concerns and then determine next steps, which may include gathering more data. The second big point is this: feeding and swallowing can have adverse educational impacts. So consider safety. The student must be safe while consuming foods and liquids at school, safe from choking, safe from aspirating. Students must also be healthy enough to attend school and engage in academic learning. Because when anyone is not adequately nourished, they do not have the stamina to access and progress with a challenging academic curriculum. Also, when students are absent because of frequent upper respiratory infections, which is a symptom of the aspiration, they're not going to be able to access and progress with the general education curriculum. And then finally, participation with non-disabled peers. This is one of the tenets of IDEA, and it includes all aspects of a student's day. So in some examples here, maybe they take longer to completing their lunch and snack time. That may need an accommodation, but maybe not therapy. In other situations, you might need an accommodation of how the food is prepared if it comes from the cafeteria in order for the student to be safe consuming it. Same thing with the liquids. In another case, the student may need special adaptive equipment, such as an adaptive cup, in order to achieve a safe position of the head and neck while swallowing. Now, all of this may sound very unusual if you're not a speech language pathologist, but again, this will be addressed in great depth in a separate video. But to be very clear, unique mealtime needs are not referring to picky eaters who are safe with their current foods and liquids. They maintain a healthy weight. They're not frequently absent. They're able to eat with their peers, as none of that reflects an adverse educational impact. So all of this to say, as a point of comparison from 2011 to 2024 standards for evaluation and eligibility, this is an important difference. And it refers to and requires very unique training and specialization, as has been previously discussed in our LEAD SLP meetings. So it is for this reason that, again, I bring up the need for the district to establish unique mealtime needs teams, because it also requires an interdisciplinary approach, including PT, OT, nursing, SLP, food service representatives, and so on, in order to address these questions. Now, again, I'm going to ask that you email me with any questions. Again, this is recorded and will be posted on the OSIS website, hopefully by the end of the week. And thank you again for your time, for your attention, for attending today. And again, if you have questions about the comparison between 2011 and 2024 criteria, please do not hesitate to email me, but otherwise look for the subsequent video series to be coming soon.